So I think we waited for the students to be joined. Actually, we have enough time. So today, just first demo, and we planned the schedule in such a way that, as I said yesterday with YouTube, so very smartly to prepare for 35 days. Okay, even though it is a old content. So what is going to study for the new students? What you are going to study for the old students? What you are going to study? I'll be differentiating the content. So today, how to prepare, how to remember the content. This is what actually I added this time as a new learning. Every time we bring something new for you people, because if I go with old content, the first time after quitting the service, I'm coming into the full time for the teaching. When last time the September NORCET, I was in the job. Okay, I was working in AIIMS. So now this time, first time coming with you people full time. So I hope I can spend maximum time this 35 days to update everything wherever you want to prepare, in hard part, like very simple as well as tough, whatever it predicts. So prediction is important. So our journey starts from today. Continuously, you'll be travel with me. So along with our team. So for the newcomers, so I welcome you on behalf of Metier Academy. I am the founder and managing director of Metier Academy. For the recently, I completely came to this post. Before I was there in AIIMS. So for 10 years of clinical experience for the new students. So this is what actually the schedule. Let us have the 20 minutes of description of schedules, because people are asking about how the schedules and how many queries are there. Let me explain slowly, because there should not be any confusion once again, because we are going to post in this in the YouTube. Okay. So it may be the old students, those who are preparing for 1 year, or those who are preparing for 6 months, or those who joined recently V9 batch, V8 batch, or V7 batch, right? So for everyone, and as well as for new students, those who enrolled for the registration, अभी इधर नहीं पूरा इंडिया में मतलब we 20%, not even 10% we use Hindi in the class. We are professionally, we take only in the classes in English. First thing I want to tell, for the outsiders, those who joined across India, our class schedules will be one in English. So no classes in Hindi in online, right? Like others, what they're doing, right? So we are the one who's taking classes completely in only one language. So no Tamil, no any other local language. So in between little language come, but not completely. Number one. So medium of communication is completely English. So all the faculties. So it is purely online. So today is a demo. We have arranged the schedule of. You can see the schedule. Slowly, I'll explain the schedule. So हमारा जो wait, what is the special of Metier for the newcomer? So we have our own pattern of teaching for the last 8 years, not only for last 2 years. So as I said, I from 2016 I'm teaching. So we have the proper schedule first of all. If without schedule, if we prepare for the exam, we can tell. And I am the one who started the first crash course in India. First crash course in India in 2015. With 3 days, I completed the BSc nursing syllabus from morning 8:30 to 6:30, and then we started to come to 5 days, and then we can come to 7 days. Now it is coming to the 35 days because of competition is high. Okay, we proudly present. We are the first crash course trained in 2015. Many people are not aware of that. And let me show my history here. So this is the platform which is 25 days nursing content revision. The schedule is content revision from Monday. So 28th, very clearly it's mentioned. What you get in content revision, you get everything which I modified the content little bit. I will show the demo now. After this explanation, how the content, old content, as well as how you can remember the content till your exam. This time I'm working in some other different ways so that you people get success rate more. Usually we get 70% success rate every time, which no institute have in India, right? We are the one is the top of success rate of across any institute. If you take, people may be studying 1,000, 2,000, 3,000, but we count the last till live classes who's attending 220 students, and we get 150, 160 achievers every time. So 25 days content revision, completely you will get every content which I'm going to schedule very clearly. And 10 days you have LMR sessions. Many new students, you don't know about what LMR, and many old students, you may be knowing what is the most important in LMR sessions. LMR sessions with the boost up session, which you get a special thing which you may crack the exam in easy way. So, and AIIMS NORCET prelim test preparations, we come with a very good test preparation this time with the rational. First time, we are going to discuss 30 MCQ along with the 2-hour live session. Listen carefully how the schedule is going to be. Okay. It is not like open sale. You are not going to get a open sale 30 test series together. Okay, I am giving the test series, you are going to practice. It is not like that. We release one test every day. Last time we did same, but last time we did at the end of the moment. But this time we are starting from the, so we are starting from the 5th. LMR is last minute revision. I will explain everything. We get a schedule. Then we go for the session. We have exclusively 1.5 hour session, 2 hour session today. How you are going to study for the content. Okay. So this is what actually the schedule, 25 days of content revision and then 10 days of LMR revision. So LMR, what is LMR? I will tell what is LMR. In the demo classes, this is what I want to tell this time. I divided the content and LMR as well as test series. You have given today the mock test which is released today in the morning. Little tough. I think the question is little tough. I know that, but still you can have coming with the, this one. No, don't worry about 30. I have seen the result. So people get 56, 46. No issue. Doesn't matter what you are scoring. So increase your confidence level. That will be good. So let us introduce. I said I introduce myself. I myself. Former nursing officer for AIIMS for last 10 years and then recently quitted the job of last year. So I completed completely 10 years of service in AIIMS, New Delhi. So full time now entering into the teaching. So this is the schedule. Oh, sorry, just a minute. Okay, so this is the 3 schedules very clearly. 25 days live session, which is going to start from Monday. Which is going to start from Monday. Yes, 3 to 9. Yes, and then 10 days of LMR revision, which is starting from 29 to 8th, and NORCET test series 5th to 4th April. Very clearly, I have to tell test series is with the live sessions, QI sessions. Every day morning, I will show the syllabus. Every day morning, you will get the syllabus. So this is for flagship course. Very proudly, we can tell this is the only course which we can proud ourselves that this is the flagship crash course, which is a perfect planning for the people those who are preparing for the NORCET. Aspirant cracking the NORCET exam in a single digit rank if you are cooperating with us, right? So we have high quality, complete nursing and non-nursing content with reviews with expert faculties. Approach experienced faculty, more than 10 years of teaching. Live and recorded classes will be provided. Don't put a question, sir, whether I'm going for duty, whether I'll get a recorded session. Yes, you get recorded session till April 14. April 14 till you will be getting. And dedicated Metier Academy app and web portal you will be getting. High quality mock tests with explanation, live sessions every day morning 9 to 11 a.m. You will be getting the live sessions and high quality study material which is there in the soft copy, not hard copy. No hard copy. We never entertain give the hard copy. Everything will be in the app. Everything will be in the app. Our content, slides, MCQ, everything will provide in the app access. And the LMR sessions are one of the booster point of the Metier, which is very important. And then you have AIIMS NORCET prelims preparation course. So which I explained you very clearly. Which explained very clearly daily 6 hours live classes will be there 3 to 9 with recording access and complete content revision of subject and non-nursing subject will be there. That is called hybrid session. In the offline, we have session in the Pondicherry, no, not in Delhi. Delhi, we have the regular batch which is going, that is only few students. But crash course, we are planning for online across India, but offline students only in Pondicherry hybrid offline classes. Those who are willing to come for offline, they can come to Pondicherry. And 10 days of LMR, which I said, ultra will be quick subjects and daily 6 hours will be there same time 3 p.m. To 9 p.m. 3 hours sessions. In that LMR sessions, what is the special? You get subject wise MCQ revision. So LMR 3 hours fundamental and anatomy, physiology, micro everything, and then you get 50 mark MCQ revision in the next 2 hours. 3 to 6 will be the LMR and gap, and 6:30 to 8:30 will be the MCQ revision, subject wise revision. So and the third package, the second package test series 30 days all India level test with live QI sessions. Daily one test will be releasing. We'll release the test starting from the 4th. We'll see the schedule and I'll give the schedule very clearly. Daily one test and QA sessions will be there from morning 9 a.m. to 11 a.m. Okay, morning 9 a.m. to 11 a.m. one sessions will be there, QA sessions. You can clear your doubts of MCQs. Any questions are wrong or any answers are confused. We can. This is very important because MCQ giving you and practice is different, and giving you along with that one faculty is revising who is expert in the MCQ for last 10 years. It will be more useful for you. Along with me, there is a set of team of faculty, 3 or 4 people who's Metier faculty. They'll be discussing the very clearly about MCQ. App access till you get April 14. Key point, April 14 till you will be getting app access. So this course currently covers AIIMS NORCET prelims course only. After clearing the prelims exam, student must enroll in the mains preparation course at their convenience with additional and app access till April 14 only, not more than that. Okay. So there is no LMR and MCQ package. Only two package we have. Only one package, test series package. Other is your LMR and regular batch package. Okay. Only two package we have, right? So there is no LMR package. So only one package which you have mentioned very clearly, which is we can see the two packages. One is 21 days, that is 25 days, and we changed to 25 to 10 days. Okay. Initially we planned 21 to 14, but content revision is very important. So 25 to 10 days LMR sessions. LMR sessions, I'll give the demo today and tomorrow how we are going to conduct the LMR session. Okay. And 30 AIIMS not NORCET test series is included along with the QA session in this pack 1. New students, those who are enrolling, right? And pack 2 test series will be 2200 plus 18 to GST. That is what 30 test series along with the QA session. Remember that we are not giving for the sale, open for sale QA session. We are going to revise you, those who joined. Along with that, we'll revise all the question paper, this test series, and then you get 3 grand test series before the exam as per the prelims pattern. Total 33 will be there. Okay, so 33 will be there. Yes, you can avail test series at any time this month. Any time you can write. There is no specific time. Only suppose for Monday we are starting the session. So Monday evening, 10 around Monday, usually every day 6 p.m. we release the MCQ in the app. First MCQ will be released on 4th evening, 6 p.m. So you have to practice. So I want to tell last time what the people did was they have started the MCQ and they entered the MCQ. They don't want to practice the question, just they want to revise the question. This time it is not possible because of section A, section B, section C, D, and so you have to write or you have to wait for 1 hour 30 minutes to finish the exam. So that is a very important thing which I want to tell. Very smartly, only 20-30% will be writing the exam. Remaining all people, you are going to sit for 1.5 hours. It's better you have to practice. Suppose Monday evening we are releasing first question paper. Okay. So next day morning 9 a.m. to 11 a.m. you will be having the same question paper revision in the next day morning 11 a.m. till 11 a.m. So before that, we request that before that you can write your test at any time in between 11 to midnight or morning. You write and come. That will be more useful for your exam. More useful for you. Those who are sincerely following the test series, and you know you can crack easily because we ourselves prepare the questions for 30, and hope so all the questions will be covered in that. Okay, so this is what actually the test series package. Those who are availing, so you are availing the test series along with the live sessions 2 hours per day. This is also included 2 hours per day. Remember that QA session, like other people in India, people are giving the sale and they're giving for the sale 999, 1500 test series or 400, 600, whatever. So we have the special. That is what actually QA session 2 hours per day every day. Today one test will be there. Next day the revision will be there. So what is the special of this? You people are in the track. We can assess you that you are preparing and next day you are coming. So we give the rational, we give the revision, and then next day you will be writing the test, and then once again you will be coming. That is one package. The second package, you are going to first package. Those who are going for first package, you are going to write the content revision as well as we are going to study the content revision. You are going to study the MCQ revision. So you will be packed with us. 30 days will be packed. Like 3 to 9 will be your content revision, and then you will be writing the test in the after going to home. Next day you will be coming for the MCQ revision. Those who go for package 1, right? So you will be packed. So we don't want to leave you like how others we give the sale, right? You people in the track. So this is the what module which we prepared, and this is important for you people, those get new admissions. So you know what is we are going to plan. And example, I'll give the scenarios also, how we go for the session, how we take the sessions today and tomorrow, so that you'll come to know those who are not joined. So this is the mode of class will be hybrid, live and recording. A hybrid offline classes only in Puducherry and with the recording. Right. So remaining people, those who are enrolled for online, they can enroll. So next thing I want to tell about the online students. Online package complete course we have left already. We have given. If you are you know that the payment method how you have to do. If there is any queries, we have the issues technical numbers. So you can see the technical number, note and keep in the brochure. Okay. If you have any issues, please go and message them. They will be guiding you and cooperate with them how you are going to join the session. Okay. So course hosted by Metier Academy, that is head office, which I am here in Chhatarpur, New Delhi. And we have branch office, 2 branch office in Puducherry and 1 in the Saket, New Delhi. We have 3 branches, 1 in Saket also we have. Delhi 2 branches we have, and Puducherry we have 2 branches. Now, the most important is the syllabus. So people never ever give the syllabus anywhere in India. They never give the syllabus. Never give the syllabus. This is what Meteor do usually last 3-4 years. We plan the schedule in such a way you give a clear live session with the schedule. So today is a day 2, 2nd March of this one. We are giving the free demo. Tomorrow will be the free demo, and from day 1 of March you get a session. I'll be taking the faculty. I'll tell the faculty also. So fundamental of nursing, 3 days fundamental, and continuous you get MS in cardio review, cardiac review, aptitude, renal. You see the syllabus very clearly we have given, and the timing is given 3 to 9, and very clearly those who are going for need a syllabus. So usually crash course without syllabus, it is useless. So you also plan schedule accordingly. So every day we get a syllabus here. So it is already, I don't know how many people have seen the syllabus. So immunology, hematology, musculoskeletal, ENT, community, aptitude reasoning, pharmacology, microbiology, infection control, and then LMR, GK, and current affairs. So 28 till your content revision, day 25, content revision is over. And then we are coming into the, okay. And then we come into the, some people are asking, what is the pay scale? Pay scale is 4,600 only. You get around 72,000 in hand, first salary. Okay. 70,000 in hand, 4,600 grade paid. Okay. Basic start from 46,000, I think. Okay. Yes. So day 6, you get LMR. Say 26th day LMR session starts. Same. What is the special of Meteor? This is what actually I can tell. Whatever I revised you, because I may be your lead faculty of research, anatomy, physiology, pharmacology, everything. So I'll be once again revising the faculty won't change. I'll be revising the fundamental research in the LMR pattern, quick review pattern. Whatever you studied in the 25 days, I'll be coming with the once again, because revision is the key part of the success. Without revision, no one can get a success. So sometimes voice is clear only, ma'am. Please check it out. Okay. Sometimes you are very difficult, and it is very difficult to see that subject wise sessions you are not aware. So we are giving the subject wise test here every day, 50 questions with rationals. I will be revising you. Message I will be taking, message fundamental, message OBG madam will be taking, psychiatric sir will be taking, community health I will be taking, and then pediatric also madam or sir will be taking. So once again you get a subject revision, quick review, and then LMR you getting whatever you studied. The schedule is once again very clearly planned. And then finally we are coming into the images, some additional session images if needed, image based sessions will be going. And then success strategies, day 37. See, 35 days we planned for the schedule, and we are planning for extra 7 days for you. That is self practice. We give the grand mock test, which is released on days 8th April, 9th April, and 10th April as per the AIIMS pattern. Once again we update the content, and finally you go for the exam on 42. That is what 14th April you will be going for the exam. So you have enough 6 or 7 days for the self study. The content is very clear and the pattern is clear. And if you have any doubt, you can ask. And if see in this side, test series side, revision is the key for success. And you start from under MCQ as per the new pattern. So I'm going to release the first test series on 4th March. That is what NORCET test series 1. And this test series will be discussed on the next day morning, 9 to 11 a.m. And this test series will be discussed in the second day. This will be going like this. So every day we'll release in the one test series before day. That is what general test series, not subject wise. It is a same like yes, this all included in pack one. Pack one, everything is included. In the pack two, those who are going for pack two only the MCQ and QA session will be there. Not LMR, no content. Okay, pack two is only MCQ plus. Okay. ESI will tell. Okay, let us start with the NORCET. ESI will come. ESI we have to run separate batch because ESI we have to work very hardly because UPSC they are taking questions. So we have to work accordingly. So after 10th of March, we are going to start with the ESI preparation, 60 days preparation for ESI because ESI exam will be on mostly on the May, right after the election. So we have 60 days preparation for ESA. That is separate. That is we are not going to involve in this NORCET because NORCET is we have to work differently. Pattern is different. ESI pattern is different. So let us see on 7th day, March 7th, they will be releasing the exam date and this one course schedule and all. So let us plan accordingly. Okay. So you see the series content, test series 11 QA sessions, test series 12 QA sessions. So this is what actually the planning. So planning makes a perfect. See, this is what every day we release one test. Next day, same test series will be discussed with the faculty as per the new pattern. Today, those who have written the exam, they may be knowing section 1, section 2, section 3, section 4. I think some technical issues were there. Some people given the complaint. Last 1 or 2 sessions is closed. Maybe browser issues or technical issues because everyone have suddenly they maybe today we are rectifying that. From tomorrow, it will be okay. Right? Same pattern we are preparing. So it will be best that you will get good practice before the exam, real-time practice test. So no one can skip. Like I said previously, lazy people. I usually question 1, 2, 3, 4, 5. So they feel lazy. Let us go for 100 questions and wind up the test. And then they'll see the rationale and they'll study. This is what mostly people will ask. Sir, they won't sit and they don't want to sit and write the exam. But now this 30 test series, you have to write the exam. You have to write the exam. There is no way. Today also I tried one test, whether it's working or not. So I waited for 1.5 hours to complete. 1.5 hours. Section A, 80 minutes. Section B, 80 minutes. You have to sit. You should not come back or should not go front also. Yes. So better you plan the test every day around 10 p.m. in the night before sleep till 11:30. You can finish it and then go for sleep. Then come for the session morning. You write accordingly your time. It's not a mandatory that you have to write in this time. So you can write at any time, anytime. Maybe when we release the exam every day 6 p.m. So 7 p.m. after the sessions, you can write at any time. So in the morning also you can write, but before the session, if you write, that will be most useful. If you're not writing, then it will be not that much of effective for you people because writing the exam, especially for the old students, those who are preparing for 1 year or 6 months, you have to practice the test series. Okay, you have to practice the test series. That is very important. Okay, so this is what the schedule till we are planning. They go 23, 24, 25 ka sessions, 25 ka next day, 26 test series next day, 27 we are discussing, 28, 29, 30. Finally, we are coming with the 3 grand mock tests. So this is the complete schedule which I planned especially this time. So how we can work effectively to get a success. Okay, so should not be any confusion here. So there should not be any confusion. This NORCET test series package is 2. This is a pack 2. But pack 1, everything is included. This is included. This is included. This is included. Pack 2 is only for the test series. Okay. So pack 2 is the test series. Clear? Any doubt? Once again, should I repeat it? Any doubt? So today's mock test I will discuss in the question series. Today I am going to tell about how you are going to write the say content, how you have to prepare for the upcoming. No skill test. Okay. So people are asking something different question. So I don't think so. So major and minor subject and all, you'll come to know what I'm going to, after finishing this demo session, you can ask, then you'll come everything. So this is what actually we have started. So clear syllabus is clear and the schedule is clear and the package is clear and the address is clear and doubt session. If you have any doubt, you go for the number, this one, you have the technical team number. Okay, no scholarship, nothing is there, right? So we are giving directly for the first time. This is a because this pattern, preparing this pattern is quick 5 days. It's very difficult because in this pattern to set in the app, and buying the app and setting this. We worked very fast. Okay, so this is what actually the plan.
Sir, sorry for the interruption.
Many
students are asking whether the pack 2, if they buy pack 1, the pack 2 test series will come or not. So can you clarify that, sir?
Pack 1, yes, test series will be there.
Yes, sir, but many students are asking that.
Why you are asking? I have given clear explanation here. See, pack 1 is everything is included. Everything is included, pack 1. See, 30 MCQ test series plus QA session every day included. 14 days LMR is included. 25 days NORCET preparation content revision is included. Pack 2 only 30 test series with QA session, that which is starting from 4th. You write the test and next day 9 to 11 you will be getting the live sessions for the this one QA session. Okay. Old students also will get V9 batch. All will get pack 1. You are already paid the money, so already those who paid 3 installment, you are included in the pack 1. Okay, V9 is V9 with the combo, no? So V9 students always pack 1. You are eligible for the pack 1. Okay, V8 no, V8 is not included in this. V8 you have to purchase for the old students package. You can see the old students package. This is the content revision plus all pack old for the old students enrollment. This is the enrollment which is included your content revision, 30 AIIMS test series and LMR. If you want to go for pack 2, no discount is the pack 2. Same 2,478 is your pack 2 involvement for the old students. Okay, so any batch V7, V8, V5 who all enroll, we are giving this discount only for them. Okay, 20% discount. So with the GST. So this is for the V8, V7 or V6, V5. Anyone who's going to join, this is for your knowledge. Okay. Delhi students, I will inform specially separately. Okay. Delhi students, I will inform you through this one, WhatsApp. Okay. So this is what actually old and new. Anything else doubt you can go, and this is very clearly it's mentioned here. Our brochure is very clearly given. Okay. Fine. So now come for the this one. Syllabus is clear. So every time don't want to tell, many people have not seen the syllabus. Okay. So syllabus, we see the syllabus date and everything is given clearly, and what is the time and everything we are given, and test series ka date and time we are given. Grand mock test also we have given. Okay, this all included in your upcoming package. So this is what actually yesterday in YouTube I have given you clearly. So I think you got a good practice today. Those who have did the demo, I think you people are aware of how the pack 2 sessions recordings available or not. Yes, you get available. No LMR separate. Say which language I want to tell. Should I tell in some other language? Please tell me which language I want to tell. It is given clearly which language I want to tell. You please tell me which language so that I can tell in that language. If you want to tell in Hindi or which language. Okay. Okay, fine. So this is what actually we have given the today's exam. I think 800,000 people have given. I think around 900 people have given. So that is good. If people have given. So okay. So please go through. I think reading the pattern. At least you should have some patience for reading this 10 minutes the brochure. Okay, before enrolling the course. Don't enroll without anything and finally put a question maximum. Everything is included in your brochure. There is no doubt should come, because clearly it is mentioned very clearly. So what is the demo class today and tomorrow, how we can have the today we have initiated the pattern of exam, how we conducted. So you can see the pattern. Those who are new learner, download our app. You can see this learn tab. You can see this one. Your content will be coming here, right? So today's exam, those who have written, you can see the dashboard and you can see the percentage. If you are availing every day, you can give the percentage and scoring and all, everything you'll get in the app. Okay. So everything you'll get mostly. Today already test series conducted. Sweta, already morning test series is done. You can open the app and do the test series. हमें कौन सा language में बताना? Please let me know. already we had a session. Morning mein to other half of the students, I think 60% students know nothing. They just come and they'll see and they'll go. We know that. Okay, already we have given the test series morning. No laptop, we are not giving access. We are not giving access for laptop, only mobile. Yes, test series rank we'll give because today morning we have started test series 10 a.m. Tomorrow night 10 p.m. this test series will make end and will release the rank. Okay, let us see how many people are attending and we'll release the rank. Tomorrow night after 10 p.m. Monday you will get a rank. Okay, Monday you will get a rank. So clear, this is what new learner. So today test series also you will get a solutions in the test series. You will get a revision. Don't worry, you'll get a revision. Today test series I given all with the rational. Without rational there is no question. Okay, so you'll get a evaluation done once today 10 a.m. to 10 p.m. Tomorrow 10 p.m. we'll be finishing the session of first free mock test, and then we can release the answers as well as your score. Okay, tomorrow night we'll release. Okay, so for the new learner, download app and see your access very clearly. It's given. Okay, so you put a question, mark and keep, and so that I'll continue the session. Otherwise, I'll forget. So this is what app access, which because many new learners, we are not giving any pre-orientation before the session. So only this time I want to give pre-orientation. Please download the app, log into your Gmail. We get the access and see the Learn tab. You'll get all the content, right? And dashboard, you can see all the scorings and all, which will be activated from the will activate from the day one of your crash course from Monday. Okay, Monday or Tuesday. Because this time we have to also work with you people because of different pattern scenario. Okay, so it is not like simple developing the app in this pattern. So we have to work with that. So we have conducted today. Once again, those who are not attend the session, you can go and attend the session after the your demo session. You can go and attend the session. It will be open in the app. You can practice and you can come day after tomorrow. You see the MCQs with rational. You can see the rational in that. All the questions I prepared with rational, so there may be not any doubt, but still you can report the question. If you have any doubt, we can answer and I'll clarify your doubt. Okay. So all the tricks will be involved in this. So offline students, you can come to, yes, tomorrow it will be offline batches. I'll be coming there. Okay. So Pondicherry students, if you are interested to come offline, you can come. Okay. So I'll be there in the offline tomorrow. After finishing time, what you are asking after finishing, can't attend, sir. Only one time you can attend. Okay, only one time you can attend. So that question paper will release once again. So for only one time, section A, B, C, some technical error, only 20-30 students, they had the issue either with their mobile or with, I don't know what was the issue. Remaining, most of the 90% students have written fully completed in the time. Okay. So some students have given complaint that section 3, section 5 is not open. We are checking for that. What was the issue? Because this is the new pattern. Everyone immediately we arranged last 1 week, day and night. I informed them to arrange this one to give best series because pattern is different. If you are giving 100 questions like previously, there is no use. So we worked fully last 1 week and we released this pattern. Okay, and moreover, we are going to work completely with you for next 30 days. Negative marking tips will get, don't worry. Okay, so come for your offline batch if you are interested, no issue. So for new students, Metier is not especially not from your Tamil Nadu students, people from across India, those who are attending. So Metier has started in 2015. I started initially with small learning in my this one setup, and then slowly 2016 as a even I'm working and as well as I'm doing this one slowly, and Metier get a good result 2019, 20, and Delhi students in the last 3 years offline classes was we are not taking offline in the Delhi. After 2019, 50 students they came for the offline and 45 they got selected 2019 in the Delhi branch. And then after that, after COVID, we have stopped this offline batches. Since I want to focus the south, so I went there. So finally, there we have developed. Now in the Delhi, it is very difficult to develop. competition is high, but still we can get success because we have good percentage of success. So it is not like news to many people are thinking maybe we are new, but we are not new. So we are old institute, first crash course trainer, most commonly first institute which I started in 2014-15. Okay, slowly we have come this way, and we have established more than 2,000 achievers across India and world for the NCLEX as well as recently our students who scored rank 1 in JIPMER proudly present. He is the one who scored rank 1, and some of the achievers we have added here so that for the motivation. So for the motivation for the new learner, old learner, so they know last NORCET achievers that I said we had a good result percentage of nearly 70% because of, see, we consider only those who are attending live classes. They came 220 students, they attend the live classes, almost 163, I think 160 students they got it in the final mains. Okay, so this is a great achievement for us. No, none of the institute they have the good success rate, even though they have good rank, but success rate percentage, we are the one who's having high percentage. That I can tell proudly. For me, it's a part time before. Now it's a full time. So I am working for you people with the updation of MCQs and so on. So let us see how this year we get a good success rate. In JIPMER 2023 also we had a good results of nearly 150 students out of this 300 vacancy. I think half of the students, the Metier students, they got 3 and 4 achievers. Also, we had good success rate of 3 and 4, and so many of the new students they're not aware. So I added this one, right? So this is the first part of the session. So anything about, because this I want to explain because people are not aware of what we are doing. Okay, so everything should know clearly the brochure, planning, schedule, and everything is there. App access is there. Okay, and we are not going to leave you. Yes, we are not going to leave you as it is. So all the faculties and everyone will work together. Let us see how we can success in the upcoming exam. Okay, so next I'll go for the second part of this session. I'll stop this and I'll go for second part. Yes. Okay, so so maybe I'm not in the MSc of nursing and PhD. What I did, I don't have time to do my MSc after the struggle of 5 years of nursing. I don't have time to do MSc and PhD. Okay, so finally quit the job recently with the 10 years of service. So this is especially for the students who is preparing for all kind of courses. Okay, so I will be teaching this in this coming exam. I will be teaching anatomy, physiologies, which I usually do, micro, and all the subjects I will be taking, pharma and emergency, fundamental, community, research. So none of the faculty will be coming in this area, and this area is a 70% success rate out of 100. Okay, so usually I give assurance before any exams. So you people are going to work with me. So I also work with you people that's coming 35 days. So let us take a challenge, which I said yesterday. So we took a challenge how to crack with a high percentage. So I don't bother about rank 1, 2 and all. Okay. So percentage of success rate is matters compared to the rank. So this is what actually the planning and schedule and everything. So just a minute. Oh, sorry, I went before. Okay. So yeah. So you see that. So this is the subject which I am focusing. So not only new, I am the faculty of last 10 years of Metier and also founder and managing director of Metier, and will be covering all the subjects what I learned in the medicine. So this is a special. So you'll be studying with me and with along with the syllabus I explained. Now usually I give the pattern of syllabus before going for the exam. So P, it is better listen what I'm telling. Okay, don't be hurry very. Try to have patience. What we are giving. Okay, so don't think yourself what you want to ask. Everything I'll give. Don't worry. Okay, listen what I'm discussing because as I said, if you put a questions, I'll get diverted and then the topic will be diverted. So what I want to tell, please allow me to tell. Okay. Okay. What I will feel. So today, this is the syllabus which you have discussed, and last nurses also I given the probable topic, and this is the same topic which I am giving. People should be very. You are the one who's going to write the exam. Okay. So you have to have the plan schedule before print the schedule and keep it right. Write you in paper or type and keep the schedule with you. How you are going to study the most probable topic in this 35 days. Okay, most probable topic how we are going to study in the 35 days. So how usually before going for any subject, any competitive exams, everyone should have the schedule in your hand. Everyone should have the schedule in your hand. Either by written, you just tick, which I said for last year. If you finish this one, which I will be taking the session, finish it, close it, and keep. Okay, I finished this one. In this, how we are going to write the notes today, I'll be discussing that. Okay, so you see, correlation panel we'll be discussing, cardiac lab values will be discussing, ABG interpretation will be discussing. And then fluid electrolytes, sodium, potassium corrections will be discussing. This is the most probable topics which you have to learn before the exam. Before going for the competitive exam, there is the foundation of basics which you have to learn completely. Like pharmacology. So you'll be learning everything with me, right? 2-3 hours, 4 hours pharmacology session. And the drains and tubes and care of client with everything will be learning with me. NG tubes, Blackmore chest tubes, and ET tubes and the findings, tracheostomy and so on. So, and infection control will be learning with me along with madam if it's possible. So these are all the procedures where you will get 3 to 4 questions from here. Okay, infection control. So put a values, 2 questions, 1 question. Okay, 3 questions, 3 to 4. Okay, so 3 questions. Yes, system wise, if we see, this is what how we have to learn. If I think about cardiac cycle before going for the exam, people should be aware of that. In the cardiac cycle, what kind of MCQ will come. So you should know one cardiac cycle is 0.8 second. What is the key point? 0.3 is systolic and 0.5 is diastolic. So this you should know. So recall what you study. Recall cardiac cycle. One cardiac cycle is 0.8 second. So systolic is 0.3 second. Diastolic is 0.5 second. So apart from that, you will be learning that deep in your system. And emergency. So emergency, all the rhythms should be perfect. Any rhythm they can ask. Any rhythm. You know that last time, here you will get 2 questions from this slide. 2 MCQ from this slide. So calculate how much questions you have. Let me check it. 2 plus 3. 3 plus 4, 7, 10. And you get 14. Maximum you can keep 14. And here 2. 16 questions till now. Right. So when you are preparing this is the set of pattern. How good evening. This is the set of pattern how you have to plan your schedule or take a printout or type and if you write and keep, paste your schedule in your home, in your hall, and keep it every day. When you woke up, you have to see the schedule. Okay, today I've completed this. Next day I will go. Whatever doubt, if you study sinus brady, 0.6 mg of atropine, maximum dose is 3 mg, and it is given for brady. Simple. Sinus tachycardia, yes, greater than 100. Sinus brady less than 60. And bradyarrhythmias less than 50. Tachycardia is greater than 100. Tachyarrhythmias. So content won't change, which I was discussing for last 6 years. This won't change. This will be the question. Okay. So sinus tachycardia, what is the sinus tachycardia? People should have a great. This is the key point. LMR you can tell. LMR session, many people doesn't know about what LMR. You may be studying the content for 6 hours in the first 25 days. LMR is this one. Okay, sinus tachycardia, recalling your content, whatever you studied for the last 25 days, and any of the new content which will be added in the LMR. So LMR, which I am also working specially for the LMR for the dosage and modification. So yesterday you have seen in the YouTube some of the rationale I given with the standard updation. So like that, we also doing the updation. So you will get updated. Okay. Then sinus tachycardia. Okay, what may be the cause? Treat the underlying management. How we do the sinus tachycardia? We usually treat the underlying cause. So it may be your pain, fever, anxiety, or any other thing which you usually. If the heart rate goes more than 150, that is known as tachyarrhythmias. So this knowledge, everyone should have this knowledge. You should keep in your mind when you are preparing the competitive exam. You recall key points. That is enough. The key points is important. Okay, so I'm giving very simple. I'm not going deeper. Deeper will be studying in your content revision. So this is the basic. When it goes to 150, then tachyarrhythmia, some people are giving stable, unstable. That is very deeper. And then first degree block, what is the PR interval, prolonged PR interval, second degree block, progressive lengthening of PR interval, second degree type 2, 2:1, 3:1, 4:1 block, and third degree block, there is no relation between P and QRS, and there will be relation between PP interval and QRR interval. So it should be going like this. Atrial flutter, atrial fibrillation, sawtooth appearance will be there. Atrial fibrillation, pulse deficit we've seen, which is the absent P wave, irregular. Yesterday in YouTube we have discussed irregular findings of ECG with the absent P wave as well as pulse deficit is seen. SVT, we have very clearly, SVT is very important condition where this all the tachyarrhythmias. These all comes under tachyarrhythmias, and you get adenosine we give, and the dosage you should know. As this is the basics which you have to recall. Okay, SVT. Okay, SVT is stable, unstable management is different, and the dosage what we do management adenosine. Okay, 6 mg, 12 mg, 12 mg. When you give this adenosine, immediately you have to assess for hypertension and all. We have to be very careful, and also there will be immediately asystole will be there in the monitor. We have to inform the sudden kicking pain, chest pain, sudden. This one will be there. Onset of sudden. Yes, yes. We have to raise the hand and immediately recall, and you paste your syllabus in your home and recall whatever you want to study. That is what best thing. And then ventricular tachycardia, ventral fibrillation, cardiac arrest rhythm you should know, and then asystole, flat line. So this is what actually ECG interpretation. So maybe you can tell, I will tell today how to recall. I have one content, how you are going to write your notes and recall your content. That content, this time NORCET, I've added as a new. For the old students also it will be new, but the pattern is new. Okay, in the short format. So how you are going to prepare in the short format? How you are going to remember 5 or 6 golden points, which is you have to remember. That only will come in your exam, for sure. Okay, then you come for the hemodynamics, which is important. We will be studying the hemodynamics, and then cardiac. Okay. So cardiac questions, so one day you won't understand anything. Okay. So you can sit and study, recall, sit and listen once again for the new learner. Okay. So this is one more thing. This is the crash course. This is not a regular batch. Okay. Those who joined fresh, I inform you priorly, it will be little fast only. Okay. Only key points you have to take down. Since we are giving recorded, you have to study. Those who are studying full time. Okay. So if you think about hypertension, if I am telling like short form this, you have studied ECG. You never studied ECG. How you understand what I'm telling? You won't understand. For you people, it will be difficult. Those who never studied about ECG, it is not possible to study in 30 days and crack the exam. To be frank, you can try your best. Remaining, the God will see. You can try your best. 30 days may you won't study everything. Okay. You have to be very smart and you put your effort. Maybe 15 hours per day. I'm not telling you can, you are not 100% you can't able to clear. You can crack. You put your maximum effort and study maximum and go for the exam. Who knows? First attempt you may be clearing. Only thing you know that you are a fresher. You should not get panic. You have to, if you are with a Metier, whatever we are giving, you can study. That is more than enough. Because you don't have time to see other content apart from the timing, because we have plenty of content to be released, and you are going to pack with every day 10 to 15 hours with us to be studying continuously for you. We never leave you till April 12, April 11. So it is very difficult for those who are going for the job. You can study yourself. You maximum you try. We are not telling. Those who are freshers, those who are preparing in home, you will be studying completely 10 to 15 hours daily. Okay. So cardiac conditions. So about these all the conditions which you have to focus, and respiratory also we are given the syllabus. So everything, if I think about pulmonary, why I've given the syllabus? When you go for sleep, before sleep, usually what I do, 30 minutes recall the same, what you studied. Opposite of you, if you have the content, okay, asthma, FE1 is important. This is the MCQ. FE1 ratio is important, which is decrease in your asthma, or peak expiratory flow rate is important in the asthma. So asthma comes under obstructive lung disease, type 2 respiratory failure. Okay, type 2. So this is the question, 4 questions are there. If you think about advanced level, this is the question. There is no question in the asthma. So how I can assure you that I can, because that is not my experience, which I can share you that 10 years. You won't get a question apart from this. One is FE1 ratio, FEC ratio is decreased, and you have to assess PFR for wheezing in the asthma and expiratory wheezing especially, and it is obstructive lung disease, type 2 respiratory failure, and you have to go for this one, which I said 1, 2, 3. Yeah. So this is about asthma. Apart from that, management, status asthmatic management will come. We can see how I have prepared one quick review slide, maybe 5 to 6 slides, how we are going to study in this upcoming 35 days, right? Okay. So this is what actually you have to prepare old students. If you think about pneumonia, always the questions are there. So crackles, rails will be there, chills, fever will be there, chest X-ray initially we have to do, and then sputum culture we have to do, and then community acute pneumonia is there, hospital acute pneumonia is there. Both organisms different, right? So recall, okay, we have which pneumonia is most commonly for the adult? That is atypical pneumonia, which we have seen, which is otherwise known as viral pneumonia, which is seen in the COVID-19. So this is what adult condition where in the clinical finding you get more atypical pneumonia. Atypical pneumonia you get. Yes, patch infiltration will be there in all. Don't stuck with that. Patch infiltration will be there in many conditions. So this is what I want to tell. Atypical pneumonia and viral pneumonia, and types of pneumonia you have. So atypical pneumonia, viral pneumonia, mycoplasma pneumonia, otherwise known as mycoplasma pneumonia. These are all the pneumonia which is seen in the adult. So and pneumonia management and sputum this one findings. So management, how we manage signs and symptoms. So key point in the community acute pneumonia, you should know about curve finding, which we'll be discussing in the demo class. So major topic which I can tell. So this is C. I forgot to give the MCQ. I'll give the MCQ side by side. But the prediction is very important. How you can get a score of 180 questions from the nursing part. In my part, you get 60 questions. Okay. Let's say I'll be preparing for 60 questions, remaining 20 questions from pediatric, OBG, psychiatric, research management. My part is 60 questions out of 100. So till here we got a 16 questions, right? Yes. 16 questions in the ECG total here 16 questions we have. And I may be adding question from here, one question MCQ. Okay, no, daily question is different. It's not a subject wise. So I want to tell once again, it's not a subject wise. Vinodini, it's a open test. Subject wise test, it is different, which we are going to release separately in the LMR. Okay, daily test, we have what we planned. Now we have planned the question, subject question, the slide itself. Those who are studying the content revision, every faculty we decided some of the updated questions along with the old questions. We are going to give 30 MCQ in the every slide. Okay, subject wise questions. That is enough. Okay, and then subject wise test will be released on the LMR session. So you will be studying in the content revision. You will get in the slide itself. You get 30 MCQ for the practice. Okay. See, 16 plus 1, 17. In the shock, you will get a question. Okay. And then pneumonia, asthma. This 3 area, you get a question. Sorry, 4 area along with that. This, if you want to focus in the emergency, they can focus pulmonary embolism. You get maybe 2 questions here. So 17 plus 2, 19. And if you see meninges, CSF, ICP, this is the area where you can get 1 or 2 questions. Okay, so 1 or 2 questions, total 20. Yes, 20 questions is done. Okay, then you get trauma. You get a question in the trauma, surely. There may be 1 questions, trauma 21. Okay, and spinal cord emergency, maybe you can add it. It's also important, 1 question. So 22. So I'll give the idea, don't worry. And there is a different stroke, and there will be question of here, 1 question. Emergency condition, ACLS guidelines, 23. Okay, and GA, maybe you get GA emergency. This is the area where we get questions 1, compulsory, nursing management or care, colostomy care or ileostomy care. 1 or 2 questions, 24, 22 plus 2, 24. Okay, and genitourinary, you may get in the questions in this area, dialysis or regarding dialysis. Okay, if not, mostly in the dialysis only they give, that is the question 25. Okay, in the endocrine emergency, DKA questions will be there mostly. or adrenal insufficiency questions will be there. But question pattern may be changed, but you may get this area. You should be very clear in this area. 2 questions, 27. Right. And then you get a question from the, if needed, yeah, this is what I said, DK hypoglycemia. So hematology, you have to study what is polycythemia vera. If you see the polycythemia vera, you should know what is polycythemia vera. And now the hemoglobin is greater than 18. The condition is known as polycythemia vera. So same like you get sickle cell anemia, DIC, hematology conditions. Mostly you get a question from this one. And pedigree also, last time you got it. Pedigree I given the last LMR sessions, I given the pedigree. The same pedigree came in your exam. Okay, that autosomal recessive pedigree and all. So here you get questions that is 27. Okay. So I can give you surety that this is the area where sepsis you get 2 questions. Okay, 30. Infections, any related to infections. Okay, you get 1 questions, 31. Fractures compulsory, you get musculoskeletal findings, you get maybe 2 questions. Prediction, 32. Okay. Then you come for the this one endometry. There will be questions on the burns, and this compulsory questions will be there, 1 to 2 questions. Okay, 35, 33, 33, 34. Okay, so this is what I discussed till this one message content. Apart from that, you have plenty of content which you have to study from the this one foundation. So fundamental, I've added only few questions here. Mostly fundamental, and this one will cover many questions. Okay, fundamental, I've added only here. This care of client with the tubes, I added only 3 questions. We have plenty of questions which is coming in the fundamental. Blood transfusion questions will be there. You have seen last NORCET 4 questions were there. Okay. Emergency, cardiac emergency, I've added 1 questions. Minimum, I added 1 questions. You get here also MI questions also. Okay, so focused area is based on this only. So whenever you are studying about asthma, COPD, pneumonia and all, you never skip the area. You have to study clearly what is the diagnostic finding, what is the treatment involved, and what is the recent update of organism, which is most commonly seen in the hospital acute or community acute, and what ARDS and ventilator critical care questions are there. So along with that, critical care questions are there. So I given minimum prediction. Okay, and you get this one, critical care questions, fundamental questions extra on 10. Okay, fundamental questions maybe you are not only apart from the fluid ultralight, you have your ABG questions, mandatory question. Okay, and you have your this one tracheostomy and care of client with the tubes. Okay, IV care, IV solutions, everywhere you get a questions. So fundamental questions, if you see overall, I can tell you funda based message, you get at least 25 to 30 questions you get in the funda based message, like procedures and everything. In the message, if you see overall, if you see messageable include nutrition questions, 2 or 3 questions compulsory. It may be from the CKD or nephrotic syndrome or any diet with mostly they put or dumping syndrome or any other condition in the GI. So most probably nutrition question, 2 questions. In the message, it includes anatomy, physiology, okay, micro, and this one conditions, systemized conditions, and pharmacology. This all together will be the 30 questions. If you divide this in the system, like systemize, the topic which I given is almost 33 questions came the message. Okay, so this is what actually happening for the last few years. In this, how you are going into the in-depth knowledge. In-depth knowledge, if you study one content, let me show in next subject demo is your how you are going to prepare the question in that content. Okay, so this is the pattern, and then come for the psychiatric. Psychiatric, you will be getting surely you will be getting 5 to 7 questions. Psychiatric minimum, I'm telling 5 to 7 questions. 10 questions surely, 10 to 12 from the OBG. Okay, so OBG may pattern we are given everything you all studied very clearly in OBG, I think, but still when you are coming for the condition, foundation subject completely finish it, tick. Okay, hyperemesis gravidum you completed, yes, tick it. Pre-eclampsia you completed. If you are completed, that means any questions if it comes, you are able to write. Okay, this is the condition, this is the answer. This is the condition, this is the answer. This is what actually syllabus before planning for the competitive exam. everyone should take written or anything should be kept, because it may be uploaded in the demo class, no problem. But still, when you are studying, you can write and keep. That will be good for you, and moreover, it will be useful. And pediatric, 5 questions, maximum 3 to 5 questions from the pediatric and newborn. Newborn is added here in OBG also, 5 questions. And then oncology, we have discussed, comes in the message, mostly 3 questions from the oncology. Okay, and apart from that, musculoskeletal we have, musculoskeletal ortho we have 3 questions. These all included in the message, 30 questions from the message. Anatomy, physiology, musculoskeletal, oncology, and MI, whatever I discussed, everything together. And message, colostomy care, UTI, and ventilator critical care, and these all included in your funda based message, critical care. So totally my side, I'll be preparing you for 60 questions out of 100. Okay, in that 60 questions, I assure you that 50 questions will be always from my preparations. You all know that, but you people will do the mistake. That is what actually you do the mistake, because of not properly revising the content. Mostly you get a questions what I will tell. I'm not telling for my self-confident, overconfident. It happens because I know that this is the pattern, how the questions will come. Because when we teaching for last 10 years, so I know every time. Today also I studied something for 2 hours, I updated. Okay, last 10 days I'm preparing for this NORCET. I don't know how you people prepare. I'm preparing for the NORCET for last 10, I think 10 to 15 days I started to prepare. Okay, what is the preparation? Any new updations, any drug modifications? Okay, because I added many things in my slide also. So something I usually tell, learning is infinity. Whatever you study, it will be going. Continuously, it will be going. It never, this will be ending studies. Okay, it will be going. Even though if you study before the exam, the same day, you think you didn't study well. Tomorrow's exam, you prepared well. Everyone psychologically same. We think that, oh my God, we not studied everything. We feel like we have not studied everything. That shows that you studied everything. So don't get panic. Okay, so it happens for everyone. So tumor lysis syndrome, you get 1 questions compulsory, oncology emergency. Growth and development, compulsory 2 questions will be there. So this is what I've given the pattern. Usually I won't explain this much of pattern, because I need a good result and more result for this time. Since I'm focusing for full time, I want to get my students to get success more compared to others. So I started to work, learn, feel, and achieve. This is the motto which I added from last 2 months. Okay, so this is the syllabus, everything. Leukemia, okay, leukemia, how they find out, what kind of leukemia is most common, what is the age, what is lymphoma, what is Hodgkin lymphoma, what is lung cancer, what is small lung cancer, what is this one, how to differentiate SML and SML, and breast cancer, you know that. And this is the type where you get a question, and how the tumor marker we can give. Okay, and radiation precaution, neutropenic precaution. So when you are preparing such a way, okay, so this is what how you get a question. Okay, so pediatric faculty, I will be taking the message, and Madam OBG Ranjini ma'am will be taking, sir will be taking for psychiatric, and Dhanasekar sir will be taking for the pediatric. Okay, so crash course only be 4 faculties, and research madam sir will be taking. Now come for the point, how you come for the, yes, how you come for the, this is exam, this is important for the exam, most probable topic. If you study this much, I'm sure you crack the exam. But you don't have to time. You don't have time for. I think those who studying before for last 6 months, you may be having a pattern, right? So this is the pattern how you have to study. Okay. So this is more than enough for your the syllabus. Don't think I'm giving as it is. It is, if you are following this, it is well and good. Okay. Anyway, we are going to study the same in the for 35 days, so that you can revise and keep all the subject key points.